Doctors should screen all adults for anxiety.
That's a new recommendation from the U.S. Preventive Services Task Force. CBS 17's Liz Ortiz spoke to a local doctor about the benefits. Liz.
Well, guys, the recommendation to screen adults for anxiety is based on a review that started before the COVID pandemic. But since the pandemic began, there's been an increase in mental health problems linked to isolation and stress.
The U.S. Preventive Services Task Force is proposing routine anxiety screenings for all adults under 65, even if they are not showing symptoms. Task Force members hope this could help identify conditions early so people can be connected to care.
I'm really glad to see that recommendation.
Dr. Maura Rinn is chair of psychiatry and behavioral sciences at Duke University School of Medicine.
And I think these disorders often go undiagnosed and unnoticed. So I think this is an important first step in order to make sure we're identifying people who have mild anxiety all the way up to severe anxiety, and to make sure that we get the right level of care for those individuals.
Studies show anxiety disorders are the most common behavioral health disorder, affecting about 40% of U.S. women at some point in their lives and more than 1 in 4 men.
I tell young people all the time, before you take exams, it's natural to get nervous. It's just when that anxiety is getting to the point of getting in the way, and some people may misinterpret that I'm just not being strong enough. I'm not trying hard enough to conquer this. I don't see anybody else struggling with this.
So what would an anxiety screening look like? You can expect a brief questionnaire about symptoms.
It kind of serves as a springboard for the primary care physician, the person doing the screening, to just have a quick discussion. Like, are you feeling that this is an ongoing problem? Is it really getting in the way of your life?
And if it is, Dr. Rinn emphasizes anxiety is treatable.
That's why it is so important to do screening and to identify those people that need treatment so they don't suffer.
And the public can comment on the proposal for adult anxiety screenings until October 17th. We'll have a link to that on our website, cbs17.com, guys.
All right, Liz. Thank you.
Very interesting stuff indeed. Thank you.